Good afternoon. I'm Dr. Josh.
I'm Dr. Kristina.
And welcome to Crossroads Chiropractic Facebook Live.
Yeah.
And for today, we are going to do kind of an issue topic. Yeah,
Yes.
we were discussing about different things that we see in the office. And one thing that I used to suffer from pretty significantly when I was younger, have you ever had it?
I've never had it.
Okay, so
Yeah.
So it's called Patellofemoral Pain Syndrome. So
Yes.
PFP.
S.
PFPS.
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 There
Because
you
every
go.
medical condition has
an
to have
acronym.
has to have an acronym.
Exactly.
If you don't have an acronym, you're not an official medical
No.
issue. Now, what that basically is it's a pain in the knee that you get when you do certain activities. So for me, when I was a teenager, I was very active. I played hockey. I was involved in a lot of sports. But every time I tried to go for a long run, after about 5-10 minutes, my one knee would kill. I'd be hobbled. It would swell. It'd be uncomfortable, and it was not good. So I had to stop. So couldn't do the track and field or the cross country running and all the rest. It was really kind of frustrating. So
Darn.
the reason why I was getting the knee pain is your kneecap should actually glide on your femur every time you bend your knee. What happens with PFPS is there's an imbalance in the muscle, so your patella actually glides to the side. So normally it goes internally. So when it goes up, it goes towards the medial, the inside of your thigh. So instead of your kneecap gliding up and down, it goes like that. Right?
Yeah.
So it's kind of on an angle. So which doesn't seem like a big deal, but that little gliding sideways, what that does is it starts to rub underneath the femur,
in the
joint, and that causes inflammation, and then that causes pain, right?
Yeah.
And so that's why it hurts when you do activity, because it's perfectly good until you get to that point of inflammatory.
That's right. You see it a lot in athletes.
A lot of athletes, yeah.
Young athletes, yeah.
So what we're going to do today, basically, we're going to go over a few different things of how to treat it.
How to tackle it.
Right? And then in the end, you probably read from my thing, how to get rid of it permanently. So we're going to talk about that.
For good.
For good. If you're interested, it takes a little bit of time, but that is so worth it. So the number one treatment protocol really for it, obviously there's, you can visit a physiotherapist or a kinesiologist, somebody who will help strengthen the leg, or someone a muscle specialist.
Yeah.
If you've seen one of my other previous videos, we worked with Strata.
Yeah.
They're fantastic. They can give you a good program on how to strengthen your leg, which is fantastic. The most common treatment protocol is one of these.
Yeah, orthotics.
These are orthotics. And what they do is basically they're firm. You put them in your shoe and they basically give your foot support. So it changes the alignment of your arch, supports it, so then when you flex, you're not pronating and it changing the muscular imbalance.
Yeah, and continually aggravating that inside. It's the inside, right?
The inside. Yeah, it's always the inside of your knee.
Yeah.
Always the inside. The vastus medialis, which is the inner thigh muscle, is usually the one that goes the weakest.
Yeah.
So that works. Those are really, really great treatments that work fantastic, and they're good. Again, temporary release, right? Because if you're not taking care of the underlying issue, you're going to have problems, which we'll talk about in a little bit. But
that's it.
The other treatment protocol that you can do, Dr. Kristina's going to do it, and she's going to show it on me.
Yes. So it's a taping method, basically.
I'm going to move so I can show my knee.
Yeah. So I need his knee up on the table here.
So you're going to not see my face.
And so basically what you want to do, it's best to use a kin tape, which is actually a little bit flexible. This is a general sport tape, which has no give.
Yeah.
But you want to have some flexibility because you actually want to be able to stretch it a little bit. So you're going to start at the outside of the knee, okay? And then you're actually going to then pull, if you can, across the top of the knee to the other side. And you might need a little bit longer than what I have here. Probably like maybe 6 inches would be good, or a little bit more. And so what that does is it helps to
stabilize the knee.
Yeah,
it actually pulls the kneecap the opposite way.
Inside, instead of having it being pulled outside, because the vastus lateralis, which is on the outside of the leg, is stronger, so it's going to pull the kneecap that way. So it's going to actually traction it to the opposite side. And I've seen it in volleyball players. It really helps them a lot. And I mean, anybody really suffering with this, but I specifically treated a few of those people.
I'm not going to take this tape off on video because that's not going to be really fun.
No.
Because as you can see, I didn't shave my legs, and that's going to be very uncomfortable. So if you are taping... Ouch, that's yucky.
Oh.
if you are taping up your knee, make sure you're shaving your legs, right?
You just got to rip the Band-Aid, Josh.
No, you shave your legs.
Just rip it right off.
But yeah, the kinesiotaping basically gives a little bit of flex, so it allows your muscles to contract a little bit more and all the rest, but it still has the amazing benefit of the athletic tape, but it's more comfortable.
Yeah.
And you can keep it on for, those ones you can keep on for days.
You can keep it on for a really long time and
Which is
shower
awesome.
with it usually, and so
Which
it just
is pretty
brings better proprioception to the knee.
Yeah.
And so, you get a reduction in pain, which is great.
Which is fantastic. Now, for permanent solution, now this is the one I always tell my patients, there's the quick answer for a lot, quick results, and then there's the long-term permanent solution. And unfortunately, long-term permanent solution comes down to biomechanics, right? Mm-hmm. You need to change your footwear, right? You need to start walking barefoot with more natural shoes. That's what I do in the office. So I recommend this for most of my patients. So how I was able to solve my knee problems permanently is I switched to very specialized running shoe. These are called Newtons, and they're designed to, if you see the bottom of them, they got like a pads right in there. So they're designed to have more of a 4-foot running position. Nice. Because when you run barefoot, you're going to run more on your forefoot than you want on your heel. So most people, when they do the running, they ran on the heel and then they roll forward. Mm-hmm. For this one, it trains you to run on your heel first, like as if you're wearing barefoot. So if you can't find these, because these are very, very hard to get to, they're difficult nowadays. Mm-hmm. Running Free used to always carry them. They're the best store. You can go follow them. They're fantastic people there. Yeah. They might be able to order a pair. But if you can't, then the next best thing is to get a shoe
like this
that I'm wearing right now, like this. And it's a natural shoe, but the thing that makes it natural, see how you can do that?
Yeah, you can roll it right up.
You can roll it right up.
Yeah.
So it's basically barefoot, so you can just pick a shoe like this and go running on it. Now, that being said, if you try to do the permanent solution, and what that does is when you're running and you're walking naturally in your normal natural gait, that will force the body to strengthen your biomechanics in the legs so that the inside muscles are stronger. Yeah. And that'll actually permanently take care of the patellofemoral problem, which is fantastic. But that does take a long time. So it's taken me a few years. I've been running like this for 8-9 years. Wow. Yeah. And actually I didn't notice until like 3 or 4 years into running, the natural running, that I was like, wait a minute, my knee pain's totally gone. Which is fantastic.
There you go, yeah. So it takes time. That's it.
Now, part of that alignment too as well is making sure your spine's checked.
Yeah,
right?
yeah, absolutely.
Because if you do have problems with your knees, you probably have some wear issues in your hips, your pelvis, your spine. Everything's all messed up. So I had the benefit of running the natural shoes plus getting adjusted, right? So they go so perfectly hand in hand. You need to get checked for subluxation if you're going to try this. So
check for any imbalance in your pelvis and your low back. Right?
Absolutely. Yeah. Absolutely. So so I hope that helps. Again, these simple solutions, they work.
Yeah, they're short term. And in the moment, if you're having an issue and you're running at that time and you need to just tape your knee, and that's going to help, then do it, right?
Or if you don't want to put the effort into doing the natural running, getting some good orthotics is fantastic. We do orthotics here in the office, or you can see a chiropodist or someone else. That's great. Yeah. But yeah, if you really want long-term permanent care, it's going to take time. Yeah. But the benefits are fantastic because you're going to have the rest of your life. You're going to have fantastic biomechanics, and your spine and your body is going to last longer. Yes. Healthier. Vital. Yes. You're going to feel better. I actually feel better. Longevity. I feel better when I'm wearing great shoes.
That's awesome.
I just do.
Yeah, that makes total sense, though. Yeah, absolutely. Great.
Awesome. So little did you know, now you are all PFPS. Specialists. PFPSS. What? Patellofemoral Pain Syndrome Specialist.
Oh, there you go. PSS. All right. That's new.
PSS. PFPSS.
We came up with it.
That's new. Coined it.
We coined it first.
We own it.
Exactly.
Awesome. So hope you like this video. If you like it, please like us, share it with all the people that you know. If you know someone who has a lot of pain, knee pain, refer them to this video. It's very simple, very quick. Yeah. You can contact us on our website, or even shoot us an email if you have any further questions, or even a comment below. We've gotten a lot of good comments. Yeah, absolutely. Add some more comments if you have a question. We'll get to those as soon as we can. Yep. And we're excited about seeing if we can help you. Yeah. If you're seeing a chiropractor,
that's great.
Keep seeing a chiropractor. And if you're not, get checked for subluxation. We'd love to see you. Yes. Check us out at www.crosschiro.ca, or you can check us out on our
social media.
Facebook,
Instagram, YouTube.
Yes. This will be up on YouTube.
Yes.
Soon, very soon. Check out our YouTube channel. We've got a lot more videos up there, which is fantastic, which is really, really good. So
good content videos.
Yeah, please look at that. Follow us. read your videos, learn something, become smart.
Educate yourself.
Actually, you're already smart if you're checking us out, so you're going to become smarter.
So you just gotta educate. Just educate. That's all. Smarter. Exactly.
Smarter. Awesome. So this is Dr. Josh.
And Dr. Kristina.
Have a fantastic weekend.
Take care, guys.
We'll see you. Bye.
See ya. Bye.